See, telecom is nothing but connectivity. Connectivity is the foundation of everything that happens in healthcare. Healthcare is becoming exponentially digital in every aspect that's possible. Whether the physicians wants to look at continuously updated evidence-based care, they need connectivity and an effective resources. To access the patient history, data, you need the connectivity. And more importantly, for coordination, reducing the errors, reducing the spending by avoiding duplicates, all of this needs to be in the tech-driven world, and it has to be accessed. That's one aspect of it. Second aspect of it is how do we provide inclusivity and access even in the remote areas. If a remote person cannot get to a far-placed hospital, or it takes longer, or even doing a small surgeries remotely, you need high quality connection, whether it is 5G or fiber optic cable. All of this need to be laid out, and it has to be uninterrupted to have a trust in the system. So this way, with a population of 1.4 billion and 65 to 70% people are still living in rural villages, that access is the crucial in my view. If you look at it, the importance of digital connectivity is understood by Modi ji better than any other leader. That's why he started this whole thing 11 years ago. If you look at it, more than 95% are 4G access. At least, some are still in 3G, small number of villages which we are upgrading. There are around 30,000 villages that need to be upgraded from 3G to 4G. But hopefully in the next few months, we will have close to 100% 4G connectivity. And then 5G connectivity, more than 80% of the population in India can latch on to 5G network, provided they have the 5G enabled phones. Right now, 25 crore people are using. But once this 5G reaches with an effective solutions to the rural villages, then whether it is telecom consultations and all this stuff will become much more intuitive and easy to use. So that is one aspect. And the second is through the BharatNet. We are laying the fiber to all Gram Panchayats. Right now, we have already done close to 2,15,000, 14,000 precisely, and another 40,000 villages will be laid out with the optical fiber. Once all these Gram Panchayats become highly stable networks, even though we have done all these more than 2 lakh villages, due to continuous works, roadway works and all that stuff, we see some of the frequent cuts. How much ever rules we put in, the states and the multiple stakeholders that are involved, even if somebody is actually watching while they're digging, it's sometimes hard to predict whether the machine is going and cutting the cable or not. And depending on that, sometimes repair might take 4 hours, 6 hours, something like that. So to avoid all this stuff, we have given a 10-year maintenance for all these village cables. And we are also building a redundant network, so where it follows a ring structure. So if it connects, then there is another alternative way to do it. Earlier, we had a linear structure. If it cuts, all the connections behind would be gone. So by doing these redundant structures, by involving private players for 10 years maintenance, we are hopeful over the next few years, we will have a much more stable connection. Once you have this access, then the entire healthcare system will work much more seamlessly. So if you look at the current speed of the internet, we're still getting around 5G will be around 600, 700 Mbps. And this will be at least 10 to 15 times more than this speed. That's number one. Number two, the latency will be sub-millisecond. So you won't lose any packets with the 6G. So the speed and reliability will be at the next level. It's almost close to the optical fiber cable level. So that's one thing, 6G, the speed. And the second, 6G, we wanted to be part of that 6G standards, the India, our research component. See, so 4G and 5G, we largely adopted from rest of the world. We were not part of the actual standards definition. So with the 6G and some proactive approach, we want to part of invention in that process. And that is why we have funded more than 100 projects, around 111 projects, the government, and we are involving IITs of the India to develop intellectual property and be included in the standards. It's the same thing, right? Once you have a reliable connection, then people don't have to worry, should I really go to that place, right? And they can get Not only the regular one, they can get follow-up care, nursing care, psychological care, anything you want. You don't need to go and see doctor every time. When you go to the hospitals and other places, you have a long waiting lines. With these kind of 6G high quality services, trust will increase. Once the trust increases, people are more likely to receive their care from their comfort areas, whether it is their home or village, gram panchayat, headquarters, something like that. First one need to understand is the internet shutdowns are a rarity and an exception. This will only be done when the government believes the risks outweighs the benefits. Very rarely, that is number one. Number two, it has a strict criteria and timelines, how it happens. To get that one, you need state secretary, central secretary permissions, and there is a continuous process of reviewing it every 24 hours, and it can never be extended more than 15 days under any circumstances. So there is a defined standardized criteria. And it is integrated between both state and the center. So this is not something somebody can do unilaterally and get away with it. So all these policies were taken care. This is a broader question and it has multiple components. So the integration, as I said, is everything has to be integrated in such a way, whether, as I said earlier, electronic health record should be integrated, their preventive care should be integrated, pharmacy should be integrated in such a way you write, clearly legitimate prescriptions, avoid drug errors. And then the insurance companies have to be brought into the ecosystem. And so there is a standardized price controls, transparency in claims can be done. And based on the patient demographic factors, whether the individual demographic factors or surrounding socio-economic factors, you can predict a lot of disease burden. So all of these can be done, but it requires a lot of resolve. People who have deep understanding can build these interoperable solutions. So these are all, again, the only way you can make it is a standardization. Standardization and capacity building. First, a knowledgeable doctor, a knowledgeable nurse or health paramedical people is the primary most important. How can we provide this kind of quality education in medical schools and make sure that they have achieved those objectives that one needs to master? Whether it is 70%, 80%, do they have the required knowledge? Are we testing them enough? And are we letting them go into then the system? That is number one aspect. So once you do that, in every aspect, if you look at the United States or any other country, there is not a single person that goes to take care of the patients unless they are validated that they have mastered it. Whether it is a nurse, whether it is occupational therapist, physical therapist, anybody. So once you put that kind of standardized system, majority of the quality issues will go away. And the second is, obviously how the infrastructure within the hospital, there is an accreditation body. We have to make sure every hospital gets accredited with the standards. So that's another kind of standardization. So these are like this, standardization is the answer for everything.